cases. That also helps us identify the hospitals and understand what hospitals will need ventilators or PPE. So this is the Detroit area. It's Oakland and Detroit, Wayne County. Next slide. We also track mortality. It gives us insight into how many clients are in the ICU and need care. We want to make sure that we're meeting the needs both on cases and really appreciating the frontline healthcare workers that are really saving people's lives. Next slide. This just gives you an idea from New Orleans. We are now also tracking St. John the Baptist Parish also, but this was New Orleans to work, and we're very hopeful that over the next week, although
the air bridge first, and then follow up on Dr. Bricks and how we're geographically aligning the supply chain. So the air bridge, we had 3 additional flights come in today, bringing 1 million gowns, 2.8 million N95 masks, 2.8 million surgical masks, 11.8 million gloves, 18.6 thousand gowns on 3 flights. And that material will be pushed out across the nation, delivered to hospitals, nursing homes across the country. Dr. Bricks went through the geography, and so over the last few days, I've been aligning the supply chain to those areas, and then reaching down into those areas and extracting data from those areas on PPE burn rates. So, for example, I spent the weekend talking to the Chief Operating Officer of Detroit, Hakeem Berry, for example, then talked to the leadership at Detroit Medical Center, Audrey Gregory, talked to the health officer in Oakland County, Michigan, and then also with the Chicago health officer, Dr. Allison Arwey. So reaching down to a level to understand their needs. So we're geographically aligning the supply chain, right? So you can see Dr. Bricks went through these counties, and we're getting down to the county level. And then aligning it by priorities of point of care. Public hospitals first, VA hospitals, private hospitals, nursing homes, first responders, acute care. So over the coming days, we will be making a push to the geographic areas that Dr. Bricks mentioned, increasing the volume through the supply chain to those areas to give them weeks, not just days worth of supply. Primarily using our industry partners that we are directing, Cardinal, McKesson, Medline, Owen Minor, Henry Schein, Concordance Healthcare, directing them to put product to the hospital door, the nursing home door, the first responders, directly to them. We're also working to push out millions of doses of hydroxychloroquine. Right, we are working the distribution there to push the same thing to the same impacted areas, working it to get in the hospitals and to every pharmacy. And so my team is back there right now, working the arrangements to make that to the hospital front door and primarily to the local pharmacies, so doctor can write those prescriptions and you can get it prior to having to go to a hospital.
Okay, great job. Thanks very much, Mike, please.
I knew you didn't say it.
Thank you, Mr. President, Mr. Vice President. My last appearance here, I mentioned that the President had given the Department of Veterans Affairs very specific instructions to be as aggressive as possible in response to the virus crisis, and not only to protect veterans, but also to help the American people. As many of you know, we have 3 primary missions at VA. One is to support veterans' health, the other is to provide veterans with benefits, and the third is memorial services. But we have a 4th mission, and that is to support the nation in times of national emergency, both in war and in peace. We provide a bridge from the federal government to the states and localities during these emergencies. As a result of that, I have ordered our veterans hospitals to begin preparing more than 1,500 beds to make them available both at the ICU and the acute care level to the states and localities across the country. As a result of that, we have opened up approximately 100 beds in the metropolitan New York area, in Brooklyn, and in Manhattan, and East Orange, New Jersey. We will be informing the governor of Louisiana, John Bel Edwards, tomorrow that we will give him access to our VA Medical Center in Shreveport, Louisiana, to come to the aid of the people of the Pelican State. I've also given instructions to initiate the 4th mission in Michigan. We will be providing the people of Michigan access to hospital beds in both Ann Arbor and in Detroit. We've also provided a pharmaceutical trailer to be used by the governor of Michigan at Cobo Hall to support the citizens of Michigan who will be coming into that facility for medical care. We have also informed the Commonwealth of Massachusetts that we will be helping them in their efforts to protect their most vulnerable citizens in 2 of their nursing homes. So, in accord with the President's instructions, the 400,000 men and women of the Department of Veterans Affairs are in this fight. We are in the fight not only for the 9.5 million veterans who are part of our service, but we are in the fight for the people of the United States.
Thank you.
Thanks.
Thank you. Mike?
Thank you, Mr. President. And you all have just heard from several members of the President's White House Coronavirus Task Force, and we are truly blessed to have the kind of leadership that we have. Whether it be Admiral Polovchek, who is organizing the distribution of tens of millions of supplies, whether it be Dr. Birx and Dr. Fauci, or analyzing the data literally hour by hour, or whether it be that whole of government approach that you stood up, Mr. President, calling on every agency of government, including the VA, HHS, and every agency. I hope the American people know, at this President's direction, we are sparing no expense. We are doing whatever it takes. We're marshaling the full resources of the federal government to respond to the challenges facing communities impacted today by the coronavirus, and making sure every community in America has the support. We've also, as the President said so many times, we've forged a seamless partnership with states around the country. As the President just reflected, by this Tuesday, with another 840 military medical personnel arriving in New York City, there will be some 3,000 Department of Defense and HHS personnel on the ground to supplement and to provide relief to healthcare workers, really at the epicenter of the coronavirus in the New York City area. And you just heard the VA is opening up bed space. In New Jersey, I spoke at the President's urging today with Governor Murphy. 500 ventilators announced today being built on the supplies that we have already provided. We were able to coordinate with him to extend all federal coordination on testing in New Jersey through May the 30th, if the need is there, and also opening up VA beds. I spoke with Governor John Bel Edwards in Louisiana, and was encouraged to hear from him that, as you heard Dr. Birx say, that new cases were down slightly. In fact, we're seeing a trend of some leveling among all of the governors I spoke to today. And I know what the Secretary of the VA just announced about opening up VA facilities has been a priority for Governor Edwards, but I assured him we're going to continue to send resources and supplies and personnel to support their health care. In Michigan today, I spoke to both Governor Gretchen Whitmer and Mayor Mike Duggan of the city of Detroit. Governor Whitmer and I spoke about a new program in Detroit that will make hydrochloroquine available for 3,000 patients through the Henry Ford Hospital. They'll be tracking in a formal study the results of that. But at the President's urging, I assured her that we're more than prepared to make hydrochloroquine broadly available to pharmacies and doctors' offices across the Detroit area as they deem appropriate. I also heard from Mayor Mike Duggan, as I told you, Mr. President, and he was so grateful to the FDA, not only for approving the Henry Ford Hospital test that will be exploring hydrochloroquine, but also for the rapid approval of the 15-minute test. In fact, Mayor Duggan told me that he was able to use the 15-minute test this weekend. 150 first responders who had been sidelined because they'd been exposed to the coronavirus. They all got the 15-minute tests. They're all back in the line of duty, and the mayor couldn't have been more grateful. In Illinois, I spoke with Governor J.B. Pritzker as well as Mayor Lori Lightfoot of Chicago. As you just heard, not only have we sent 600 ventilators to the state of Illinois, but I assured the governor, I assured the mayor that while the principal focus that we have in the next several days is on the rising cases in the greater New York City area and Louisiana, that Michigan and Illinois are in the forefront of our thinking, and at the president's direction, we're going to make sure the people of Illinois, people of Michigan have the resources, equipment, and support that they need. The governor did express great appreciation for the fact that our Army Corps of Engineers had constructed 500 beds at McCormick Place, and before the end of this week would construct another 2,500 beds for an overflow healthcare facility in Chicago. In fact, Mr. President, Mayor Lightfoot told me that the Army Corps was just outstanding in the job that they had been doing in constructing that extra bed space. As I close, let me just express, as the President did, our profound appreciation for Governor Kate Brown and Governor Jay Inslee. The state of Oregon and the state of Washington are leading by example. Oregon sent 140 ventilators to New York City. They looked at their circumstances and concluded that they could spare those at the point of the need. And because of the low and steady numbers in Washington State and in California, Governor Inslee today announced that they were sending 400 ventilators back to the Strategic National Stockpile, and those will be deployed at the point of the need. You know, not only are California and Washington State low and steady, but frankly, as I talk to governors and mayors today, I want to say to the American people that we are beginning to see the glimmers of progress. The experts will tell me not to jump to any conclusions, and I'm not, but like your president, I'm an optimistic person and I'm hopeful. And the truth is, we're starting to see cases and, most importantly, losses and hospitalizations begin to stabilize. But make no mistake about it, I want to say to the American people, if that holds, if that's happening, it's because of what all of you are doing. It's because the American people are putting into practice the coronavirus guidelines for America. You're listening to your state and local officials. You're practicing social distancing. You're using drive-throughs instead of going into restaurants. And so on behalf of your president and all of us, working really at every level, I just want to say thank you, America. Thank you for responding. Thank you for putting other people's lives in the forefront of your thinking, putting it again over and above your own inconvenience and difficulty. Because of your efforts, there is, as the President just said, light at the end of the tunnel. And I'm absolutely convinced, with the continued cooperation, patience, persistence, and prayers of the American people, we'll get through this. And we'll get through this a lot sooner than we first thought it would take. Thank you.
Mike, very much. Thank you.
Mr. President.
Go ahead.
Yeah, Mr. President, if we could start with the Admiral, if that's right for you, sir. I wanted to ask you about the air gap flights, sir. There were the 2 flights that came through. The 3 flights, where did they come from, sir?
They came from Asia.
Asia, okay. And then you were mentioning all these supplies being dropped off, the masks, the gowns, the hydrochloroquine. How are you guys making sure that there's not a run on these products? You know, you drop them off at Hospital A and that people just don't rush and go grab every mask, gown. And then a question for you, sir, after that.
Right, so it's going to the loading dock, and there's an invoice. And so those people that are responsible for that loading dock and that invoice, they're going to make sure that there's not going to be a run.
We're not run on any of these. Okay. Thank you, sir. I appreciate that. Mr. President, first, did you have a chance?
We do get orders for a lot more than sometimes we think an area needs. Generally speaking, we like to either negotiate that down or give it to them as they want. So we've had a lot of orders that we think are high, but we generally like, if we have, for instance, with the medicines and with other things, we like to give it to them. Every day we're building up and building it up very rapidly and deploying it. But we do get orders from some of the states where we don't think they need it. We try and get it for them what they want anyway. Okay, go ahead.
And then, you off the top. Have you had a chance to
Yes.
speak to him today, sir?
I didn't speak to him, no. I did get a call from the ambassador. And, hey, it's a big move going to the hospital. That's a big thing. He's a great gentleman, so I just hope he's okay.
And then also, you mentioned the nurses, the doctors, the people that you
Yes.
see celebrating. Sorry, the people that are gearing up and getting ready, the people that are applauding and celebrating him. Has there been any talk on any level whatsoever of some sort of either compensation fund or protection for nurses, doctors? Because there's been a lot of fear. There's been some people that said, I can't risk my family's livelihood. I can't go back to the ER. Has there been any
Well,
discussion?
we're talking about it, and we're talking about doing something for them, but we're really looking at the conclusion. We don't want to focus on that now. They're incredible. They're not saying we're not doing it. They go in with good equipment, with great equipment, and with stuff that's not so good. And sometimes they catch it wearing the best stuff you can buy, brand new, the best stuff. This is a very tough enemy. But these are amazing people. No, we are talking about something, but we're really thinking about, let's get it finished first before we do that, please.
The Surgeon General this morning was talking about the coming week being among the hardest and saddest weeks of our lives. He was talking
Tough
about this
week.
being our Pearl Harbor, our 9/11 moment. You all are talking about glimmers of hope and stabilization. How are the American people supposed to bridge those different descriptions that they're getting from this administration?
I don't think they're so different. I think we all know that we have to reach a certain point, and that point is going to be a horrific point in terms of death, but it's also a point at which things are going to start changing. We're getting very close to that level right now, and the next week and a half, 2 weeks are going to be, I think they're going to be very difficult. At the same time, we understand what they represent and what that time represents, and hopefully we can get this over with, because this is a very horrible thing for the world. And look, we're one country out of 182 now that have 182 countries. I have a friend of mine said he didn't know we had so many countries in the world. 182 countries are now affected by this, so we want to get it over with. Okay,
And
please.
with those numbers, sir, could I just ask one follow-up
Yes.
on those numbers that you were talking about earlier? How does that change the projections that you were making earlier this week of 100 to 1,000
Well,
to 240?
we hope we can stay under those numbers. Those are numbers of death, and we hope we can stay under those numbers. That would be terrific, and as far under those numbers as possible. Now, if we did nothing, you know that number too. But the American people really stepped up. So did the professionals. They just really stepped up. So we're hoping to stay under those numbers. And that means the minimum and the maximum, but we're hoping to stay under the minimum number. You know what that number was.
Right, but do the that you were talking about today, have they changed those projections?
I would say the answer is yes, but I would also say that we're not going to know really in terms of a final toll until we get out to the end. And we're probably, possibly not so far away. We're getting closer. But it's our goal to far under that minimum number, the minimum number as possible. Okay? That's what we want to do. Go ahead.
President, as President of the United States, your words carry enormous weight in this country and around the world. And while you acknowledge you're not a physician, you do promote these medicines extensively here. How do you not go so far as to
Really well. You couldn't use it for years because they would take years and years to test. So with the help of also Democrats, I got it bipartisan, but they've been trying to get this passed for decades. You know that. It's called right to try. So a person would be diagnosed terminally ill from something. And in the old days, meaning before a year ago, they would say, do you think I could try this this pill, this whatever, this medicine that's testing so well. No, you can't do that. You can't do that under no circumstances. They'd leave for Asia. They'd leave for Europe. They'd leave for, if they had money. If they had no money, they'd go home and die with no hope. We got a thing called right to try. If somebody's very ill, terminally ill, they're going to die. And it was very complex. It wasn't as easy as it sounds because there were huge liability problems. The drug companies didn't want to do it because they didn't want it on test results because these are very sick people, so they didn't want to bring down their test results. The insurance companies had tremendous problems. I got everybody in the room. I said, look, we'll sign a waiver. The person taking it will say, we're not going to sue. The family's not going to sue the drug company, not going to sue the insurance company, not going to sue the state, the city, or the federal government. Okay? It's called exculpation.